I think our whole approach for restorative justice and learning culture, and how we're focusing on our perfect goal about becoming actively anti-racist and not accepting of discrimination or unacceptable behaviours of every kind, they apply to everyone. We've been very honest in terms of our international workforce that when they join us, we've talked about racism, and they've asked questions about racism, and we haven't shied away of that. We've really taken that to the table, so they've got a real solid awareness about what to expect. We've given them lots of support within the organisation, bringing them into the organisation. But certainly one of the learnings that we've had from our first cohort of international recruits is the fact that it was the support packages for other colleagues, other allies, people like me, where those international workers are coming into the workplace, to really give them the insight and knowledge that these individuals come with a vast amount of skills and experience, although they're coming in initially, sometime at different levels, not to ignore or undervalue the experience and the knowledge base that they have. So it's actually, again, making sure the landing is communicated, not just from the people who are coming in and joining in the team, but the people in the team who are receiving them. So that wider team dynamic, that's been some of our learning and insight.
Our international educated workforce can benefit because they're all being embedded into the minority ethnic staff network. We do have positive actions within the trust, with ring-fenced allocated spaces for colleagues of colour to undertake our varied level leadership development programmes. And again, we work with our minority ethnic colleagues to ensure that they take time to listen to the newly settled and interns who are coming in, to provide them with that support to move forward and really see coming to Mersey Care, going through that massive cultural change, that we actually want the best from them. We want to learn from that high level of skill. We know from many other international cohorts over the years that the training in other countries, there are certain advanced areas that people don't do as part of the registration in the NMC in the United Kingdom. So we have recently had a celebration launch where all the senior execs and our chairman was there, and we brought in the chairman of our integrated care board too, with that real message of, now you're here, you're gonna grow. We want to see the best of you. We want you to teach us. We'll give you that step up the ladder, but we need you. And I think that's that real honest approach that we have at Mersey Care. And for them to come, some of them after 6, some had only been in the country 3 or 4 weeks, and for the people who've already been here for 12 months. And so, we're taking an honest and engaging approach. We want, as Amanda said, to benefit from all their learning and that insight that they can bring us.
There's been many challenges over the 7 years of introducing restorative justice and learning culture. I think for us at Mersey Care, the first challenge was we were probably the first who was implementing this approach systemically across the organisation. So the tools and mechanisms that we have now and developed and co-produced with our staff side colleagues and freedom to speak up ambassadors and operational colleagues didn't exist when we were starting. So we were asking lots of questions, and we were sort of driving a bus and changing the wheels along the way. So it was very emotion learning. But actually, the things that we've learned is that continuous review constantly of what we're doing is absolutely paramount to continually drive that improvement, and getting that understanding and sense making is critical, and reflecting on those cultural sensitivities that we need to be aware of. So there's a lot of bias in our thought processes and our decision making. Some of them are cultural sensitive, some of them depend on the communities that you come from, some of them are spoken, some of them are unspoken. How do we actually hold a mirror out and flush some of those out to make sure that we design systems and processes that align with what actually is going on for operational colleagues on the ground? So I think often there's an incongruence with what people at the top of the organisation think is going on at the bottom of the organisation. So how do you design in systems and processes that bring them together? Absolutely having dialogue with conversations. So not just looking at your data, having that rich intelligence through speaking to colleagues who've been subjected to our processes and have an understanding and greater insight of what's occurred, and obviously saying sorry when things haven't gone to plan or as expected. And I'm very deliberate in my language in terms of saying something that hasn't gone to plan or as expected, because that's been a key learning for us, is language. How you frame something is really critical to the impact. So if I said to you, why have you done something wrong? Your defense mechanism comes up, and it may affect the level of detail you give me, which actually could prevent a similar incident reoccurring. So it's constantly being on the lookout for those moments. So the closer we align the design with what's happening on the ground is your safety dividend. It's your safety dividend for your patients, but it's also your safety dividend for our staff, because our staff can be vulnerable too in the direct delivery of care. And we have to be conscious that I believe our staff come to work to do an absolute amazing job nearly every single day within the organisational life. Do they bring their A game every day? No. Why? Because we're human, and sometimes we don't feel on our A game. So it's an awareness that we can speak up, we can raise our concerns. We have to recognise how much more difficult that is for people who are multi-ethnic colleagues to speak up and raise the concerns because of that power and privilege imbalance. So we have to think about ways we can invite that in. But the most important thing that we've learned about our restorative journey is it's far better to prevent the need for restorative approaches. So by that, I mean, don't break something. If you don't break it, you don't need to restore it. And that leads into your values, your systems and processes, your behaviours that you accept and tolerate within an organisational culture, within teams. So if you can think about preventative measures through your mechanisms that you have, through your education, through your leadership development, your management development, your appraisal conversations, your supervision conversations, it may help us to deal with something downstream rather than having to restore it because it breaks. We prevent it happening in the first place. And that is a full cycle of learning. And that's why learning is so paramount. We have to learn at an individual level. Of course, I've got things to learn. We also have to learn at a team level, a divisional level, an organizational level, and a systemic level. If we're not learning in all those ways, it could mean that we are attributing blame and the focus is too individualized, and we're not looking at the wider contributory factors that exist in the delivery and doing of frontline care in our jobs.
In terms of what Amanda related to, we took a positive action in the autumn and recruited a minority ethnic cultural sensitivity lead and freedom to speak up guardian, because we knew from our listening that Amanda related to through our work with the staff networks and our just and learning culture. It's about approachability, and that for some of our minority ethnic colleagues, as Amanda had said, may feel reticent at an early stage to raise a concern or question a decision. So by bringing in a person who will both develop our sensitivity and leadership awareness and being somebody that perhaps they may feel is more approachable to have conversations with, we are seeing positive results, which have led to us doing some educational training within various areas in our trust where minority ethnic staff had occasionally faced racism from patients. And that also includes a complete review of our reporting systems to have an up-to-date and more interactive system to look at instances of untoward conduct such as violence and aggression towards all protected groups, but particularly making sure that staff feel confident to look at the area of microaggressions. So we included microaggressions in our rebuild and the training around that, because they can often be not taken seriously at an early stage. And we know from many reports across the NHS over the years, and particularly in secure services, that sadly that's led to some very negative situations for patients of colour and also colleagues of colour. So we really looked through that EDI lens, an intersectional lens, but also a practical and attentive listening lens too, and building up trust by being honest and saying, we are a restorative values-based organisation.
I suppose it's too early to tell yet, but the staying with us, the progressing and the learning with us, and the feedback that we've received is very, very positive. We certainly haven't had any experience of bullying and harassment within the organisation. There have been things that we've had to support teams with, but I use that in the holistic sense because it's about the team-based working and the team-based learning within the organisation. So being very clear about what team purpose is and how everybody can contribute to the teams, what their objectives are and how they will be delivered through that values-based approach. And our international nurses have been part of that in the team that they work with. So very early days, but really we've received good feedback, and where they've highlighted areas of concerns, we've made sure that we've addressed that in our second cohort.
Yeah, and again, just touching on the fact that we have our practice education facilitator, who is a young man of colour who works very closely with all our international educated workforce, and our cultural and sensitivity lead, Freedom to Speak Up Guardian, who's an ex-senior sister as well, and an internationally recruited nurse. So we understand it's very important for us. Amanda and I don't claim to be representative of our workforce, and we would try to be attentive, but there are times where we need to have the availability for our international nurses, especially when they feel vulnerable and testing out culture and bias and not understanding our north of England terminology and subcultures probably would be a challenge for anybody from the country to get used to. So working with our practice education facilitator, our cultural sensitive lead and Freedom to Speak Up Guardian, and our minority ethnic colleagues is our interface really. And again, Amanda in particular regularly meets with our joint staff network leads. Again, and this is another area where we can ask questions and review how effectively our support packages are.
We've written a book on the learning in terms of restorative justice and learning culture trust-wide, which does reference at a board level the importance of having that senior commitment. That it's not just rhetoric, it's underpinned with education, supportive challenge and support. So I think both the visibility and the actions of the senior executive team and the wider board in this space are paramount. And our organisation has been exposed to the learning that we've had on our journey about becoming actively anti-racist and squashing out discriminatory behaviours and also disrespectful behaviours. We've talked about it a lot on International Nurses Day, which our allied health professionals have also been invited to. We've shared our learning, we've described our journey, so they can see how seriously we're taking this and the board and leadership commitment to it. But it's not just about those leaders. Everybody is a leader within that organisational hierarchy. And what are we doing to educate and support all our leaders and our white allies to actually all take personal development and action to make sure it's better for all? So as I said, we're at the beginning of our journey. We're absolutely not there yet. It really is learning as we implement, a bit like how we started with our restorative justice and learning, a culture approach all those years ago. But I think that approach has given us the foundation to ask ourselves difficult questions, to set ourselves really high challenges and high, desirable outcomes that we're aspiring to achieve, and not giving us simple tick box things like, let's amend a policy. What are we actually doing to make a difference, and what impact are we actually having? So our ask of ourselves is high, our people can see our ask of ourselves is high, and we're being transparent and open about the learning. And that means when we haven't had the success that we wanted, and understanding why and what we're going to do to make that right. I give to other board leaders who are looking to support their international workforce is to make sure you go on your own development journey to understand what it's like to be an international worker coming into an organisation that is possibly, certainly in my case, predominantly white. And what could that feel like, and how they could experience the organisation. Obviously, you look at your metrics within your organisational surveys, etc., but also maybe talking to people of colour and speaking to our international nurses to understand what challenges they face, and then through the actions and support that we offer, demonstrate that we learn in implementation. So I've referenced before the learning we've got from our first cohort to bringing in our second cohort. That needs to not just be words, but it needs to feel and be experiencing differently in their landing.